that Lillian is going to provide. And so let's jump right into our KUAM News Zoom room again, where we have standing by Hospital Administrator Lillian Posadas. Lillian, thank you for joining us. I know it's a busy morning, a crazy, rough weekend. Our thoughts and prayers with you and the staff, and most especially with the families, the five
Right.
families who have lost.
Yeah.
And we'll just get right into it, Lillian. If you can give us the COVID census at the hospital, and then maybe any additional information you can on the deaths that we have seen, the COVID-related deaths since Friday.
Okay. Yes. Hi. Good morning, Chris. Good morning, Sabrina, Jason, and good morning, Guam. Our census this morning is at 51. We have 51 total COVID individuals in the hospital. Of those 51, 14 of them are ICU level of care. And of the 14, 12 of them are on ventilator support mechanism. And so we've got really, really sick individuals in the hospital. And, they continue to come in. As far as the deaths, again, we're just our condolences and our prayers to the family, because it's painful, it's difficult, and we have to keep in mind that we're not just looking at statistics, but we're also looking at individuals who are loved by their families, and the families who are left behind are hurting, they're grieving, and so we just have to kind of give them that dignity and that respect that we really don't want to say a whole lot anymore about their passing, other than to just really, offer our condolences and our prayers and our, support to the family, because it's not an easy thing to go through. It's quite a painful, experience. And so, without saying any further, yes, we lost several throughout the weekend.
Lillian, I really hate asking this, but since the 17th and 18th, has there been any other COVID deaths at GMH? Or that
Not tonight, not throughout the night. There hasn't been any, but we really have sick individuals, and so at any moment, their respiratory system, although they are on ventilator support, the respiratory system could shut down or could really go deteriorate, and so at any moment, as we have gone through, they could go into a respiratory arrest,
right?
And so we have to continue to resuscitate them as much as we can to save them. And so that's what's been happening. These individuals get so critically ill that they crash, and they go into cardiac respiratory arrest. So we have to call on code blue and resuscitate them.
Lillian, I was talking to one of the doctors this morning, and he said, look at the number of people on the ventilators, and these are, unfortunately, the patients who are oftentimes the first to go because of what you had just said. And this doctor said anticipate more deaths this week.
Well, because there are 14 of them on ICU level of condition, but then the others could also, even though they're stable, they could at any given moment they could crash, and so that's why we're monitoring them very closely. In the ICU, which is our Care 5, we've opened that up to now be 12 bed. Strictly COVID ICU patients. And in addition to the 4 bed in Care 2, we have 4 ICU patients in that area, and they're all 4 are on ventilator. And then we also have patients in the Care 4 area that is on the 3rd floor, and some of them are critically ill. We even have a couple who are on ventilator who are ICU level of care. So trying to accommodate them wherever we can.
Right. It sounds like you're constantly moving people around. And so what is the update on the skilled?
Constantly.
Right.
What was that?
What is the update on the skilled nursing unit? Last we checked, Crystal Paco said that it was Crystal Paco San Augustine. She said that it was going to open, and you were going to start taking patients over the weekend, and we found out that hasn't been the case. So if you could just provide information as to what happened.
Sure. That's what we've been pushing. We've been pushing it since yesterday to get that SIF, that SNU open, and it is, ready for occupancy. Unfortunately, the acute and critical patients on our side here in Tamuning has taken our focus and our attention to really, and plus our staff. We have several that are out because they have contracted the COVID infection, and so we're constantly, not only are we constantly juggling and moving patients around where we can best accommodate them given their situation, we're also juggling staffing around when they're out. And we're just very fortunate, we're very blessed that we have the DOD nurses, 10 of them critical care, and so we're maximizing their availability. We're strictly utilizing them in the ER and in the ICU to cover where our shortages are. And so 12-hour shifts, so they're helping us out tremendously. It's just that on our own staffing, we are out several nurses. So that's been our battle.
Yeah, when you gave us a count last week, I want to say it was, that there were 32 staffers at GMH, to include nurses and doctors, that had came down with COVID. And so, do you have a new number? Are there more than just the 32? Did that number also go
Right
up?
off the bat, no, but I know that there were several others that our infection control nurse and our employee health nurse have been sending us, information as far as who else are out. And so those numbers probably around 6 or maybe even up to 10 additional staff were out. And so, but those who were amongst the 32, some of them have been cleared to come back. So, it's just a revolving process. So it's ongoing.
Lillian, I wanted to ask about the help we got, right? So we have the 15 critical care medical staff there. And then correct me if I'm wrong, but it's my understanding that while they're here for 30 days, we have to work on securing a contract for additional medical.
A long-term plan.
Right.
Absolutely.
So I'm just
Yes.
thinking, with everything that's going on with the hospital, because obviously, I mean, you guys are overwhelmed and inundated. If we have 30 days to come up with this plan, is it feasible? Can it be done?
Well, according to our conversations, we have been in touch with an agency that is in California, and we're meeting at 11 o'clock. We're doing a Zoom meeting, but we've been in conversations with the director, and that she assured us that by next week, once we sign the agreement, by next week, she can send us nurses.
Right. You mentioned this actually in the press conference last week, Friday, that you were having discussions with some off-island recruiting agency. Now we know it's from California, and that the
Correct.
possibility that 100, I think it was, you said, nurses could be coming to Guam. Is that still the case?
Well, we're looking at our numbers as far as how many we would like for them to bring over to Guam. And so, we're going to finalize the details at 11 o'clock when we Zoom in. But yes, she has said that she can give us 100, nursing staff. And so that's great news. It's a great infusion, to help us out. And that will help us really open up the SIF and every room that we can then accommodate patients.
And that is 100 for the Guam Memorial Hospital. This is not 100. 50 is going to go to GMH. 50 is going to go to GRMC or anything like that. It's all GMH.
That hasn't been discussed as far as but GRMC needs help, and so, why not? We are one healthcare system, and so if it's going to help GRMC beef up their staff to then help us decompress our non-COVID patients, that would be great, because we've already talked to GRMC leadership that we're not going to be accepting any more non-COVID ICU patients. We are strictly the COVID ICU unit here at GMH, and GRMC will then take the non-COVID ICU level of care patients. And so, they're going to need help, of course. And so, I have no problem, providing assistance and support there too, because it's only for our entire healthcare system. It's not just for GMH, it's for the entire healthcare system for Guam.
Right. Okay.
Anything else, Lillian, that we didn't ask that we should know about, that you want to tell us?
Well, like I said, we're constantly, doing things to really accommodate the individuals who are sick. But if I could just again pitch this, recommendation and this suggestion that, people, please don't wait too long that you're having a difficulty breathing or that you're, dehydrated. Get medical help as soon as you can in the private clinics, your private provider. And as much as possible, really let's fight together against this virus. The virus is our enemy, not each other. And so, again, I just put a plea out there. Let's work together to fight this virus so we can then have some normalcy. Because, I like to go shopping too. I just haven't been able to. So, but, we have to stay in this together.
Yeah.
All right. Thank you, Lillian.
Thank you, Lillian.
Stay healthy.
Yeah,
Thank
be
you, too.
safe, okay?
Yes, you too. Take
Okay.
care.
Okay,
Bye-bye.
and thanks for joining us, Esther. Okay.
51. That's the latest.